Well, the hope of the crisis services system is to get individuals the help that they need when they need it or where they need it. And the other aspect of the Colorado crisis system is to provide law enforcement also customer service to get the support that they need, and in that way law enforcement is back on duty.
We collaborated with fire and GPD, Greeley Police Department, because the importance of being able to offer a client exactly what they need in their moment is a part of what we all bring to the table.
The frustrating part for law enforcement, or has been for a long time, is that there's, other than just giving somebody a phone number, which even then they might not even have a phone number or a phone to use to call that number, it's really not, it wasn't very effective. So when you call somebody, just like people need us, we'll respond, we can call Squad 1. And when they come on scene, we've already prepared this individual that we have friends, we have relationships with these individuals who have a somewhat of a similar purpose that we have of keeping people safe and trying to do the best thing to help them better themselves or better their situation.
The Squad 1 came out of kind of an experiment to see if having a therapist on board with fire crew, if that would alleviate some of the stress, some of the pressure on the 911 system.
What is a true emergency? Chest pain, shortness of breath, a stroke, yes. Can a anxiety attack, can a mental health crisis be an emergency? You bet it can. But who is better equipped to fit that need? And that's where crisis comes into place.
So a typical process for us is dispatch announces over our intercom system that there is an individual who needs some sort of service. And for instance, a dispatcher may say an individual who is passed out on the ground. That for us might be an important call for us to respond to based on they could be intoxicated, lots of different things. And if we respond on scene and the issue is a mental health issue, then our engines need to get back in service so that we can help that individual get to the right place.
So that warm handoff is so important with Squad 1. So they show up, boom. Most of the times they'll be able to go with Squad 1. Some of the times they might be afraid for whatever purpose, or we may actually know that individual because we have a good relationship, and we can then voluntarily get them to go with us to give them a short ride to the crisis center. The Squad 1, of course, meeting them there.
So when there's the initial contact, if let's say a police officer brings somebody in, that initial contact is like, we're hearing from the police officer kind of what's going on, and we're also trying to make sure we're hearing from that person of what's going on.
And once they realize that they're safe, a lot of that fear disappears, and they can work on fixing that self-doubt, work on getting stronger, opening up.
Crisis looks different from person to person, so what our job is to try to figure out how we can help at that person's level.
In respite, when someone is in crisis, we can provide them with a place to stay for 2 to 14 days, depending on their treatment plan and how they are working towards their goals.
We offer life skills, we offer resources.
Outpatient therapies, intensive outpatient therapies, resources for things like the residential treatments.
Any treatment that can help them towards their recovery, we can provide transportation for, providing them with hope.
We're getting them what they need. It's not just a business, it's really that we care about them.
We trust the crisis center, we trust the people in the crisis center, and we've seen successes.
I'd say the biggest thing with this relationship with North Range is this isn't happening anywhere else here along the Front Range. So it's nice to be able to have people that are having an emotional crisis, be able to go somewhere other than the emergency room.
So to further support law enforcement first responders, we have an 800 number that's statewide that they can, and any first responder law enforcement can call. But for North Range Behavioral Health and Weld County, we have an 800 number that is local and staffed 24/7 to provide over-the-phone triage if you have questions or concerns about someone you're meeting with that may be in a crisis of some sort. So our hope is to continue to grow relationships and establish new relationships that will benefit our community as a whole with crisis and the needs that occur.